Coming down the ladder now.
Roger. Base 5 clear.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard.
Please welcome to the stage StartUp Health's president and co-founder, Unity Stoakes.
All right. Welcome to a new decade, 2020. Welcome to the 8th annual Startup Health Festival. To all of you on live stream, welcome. Thank you for joining us. I'd like to start by thanking all of you. I'd like to thank you for sharing your time with us. I'd like to thank you for being a part of the Startup Health community. And I'd like to thank you for doing what you do. Everybody here, we all care about the same thing. We're all trying to transform health. Over the next 2 days, we're expecting 2,200 guests. 2,200 guests. I don't know how we're going to fit everybody in this space, but we're going to do our best. We've got 275 founders from startup health companies here that are going to be here over the next 2 days. And one thing that's really cool, we've got innovators, investors, entrepreneurs representing 35 countries. So it truly, truly is a global community. Here's a cool fact that we're really proud of. Unlike in the tech world or even across the street, here, 41% of startup health companies participating have a female founder or co-founder, 41%. Soon, hopefully 50 or even 60%, so we're working hard on that. Incredibly, and this exceeded our own expectations, there's already more than 2,300 pre-scheduled meetings taking place upstairs over the next 2 days, 2,300. There's still time to book more meetings using the Startup Health app. Again, I don't know if there's going to be enough tables, but we will get creative with you, standing meetings, whatever it takes. There's health transformers here that need your support. They need your wisdom. They need your guidance. So please take time to meet with them. Over the next 2 days, we will learn from a diverse group of extraordinary people. We've got over 40 fireside chats taking place here on this Health Moonshot stage. As Steve knows, about a year ago when we started planning today, we said, let's simplify. Let's do 2 or 3 fireside chats. There's too many awesome people in the world, so somehow there's going to be 40 fireside chats here with health transformers, entrepreneurs, global leaders, CEOs, executives. We got caregivers, patients and their advocates, and we even have a 4-month-old baby, which I'm really looking forward to. It's true. And as you may have seen the cameras around, but if you tune in to Startup Health TV, we're also going to be featuring 100 interviews over the next 2 days with startup founders. 100 interviews, broadcasting live downstairs. If you get a chance to join in on the fun, hope you also do an interview. And hot off the press, Startup Health Magazine. This is issue number 5. This features the superheroes of our time. This features health transformers. These people are upstairs, they're here, they're downstairs. This is you. We're trying to share your stories with the world. So hope you all get a copy of that and pass it on to other people as well. So where are we? We're nearly a decade into this mission at Startup Health, working to achieve 11 health moonshots. And I gotta say, it's hard. It's really, really hard. And it takes a lot for me to say that. But as everybody here knows, trying to transform this industry, especially from the entrepreneur's perspective, it's not easy. Over the past decade, the Krein families and Stoakes families, the Startup Health team, our partners, and a community of hundreds of health transformers, we're going all in. We are all in on what many believe is an impossible dream. We're trying to improve the health and well-being of everyone in the world by 2040. You know, we set out to build a global platform to invest in and unite thousands of health transformers. These are the world's entrepreneurs dedicated to achieving health moonshots, so that together we can impact billions of people's lives. It's been rewarding, it's been challenging, but here's our message. Might be the 8th annual Startup Health Festival, but we're just getting started, and we need all of us to work together. So, to kick things off, my business partner of over 20 years, brother from another mother, co-founder and CEO of StartUp Health, is going to share our plans for the next 20 years. And he's going to share a concept that we've been working on called Health Moonshot Investing, and really share why we are more energized than ever. Steve?
Great job, man. That was awesome. Love it, brother.
You too.
Good morning. Good morning, good afternoon. For those watching on live stream, I am honored once again to, with Unity, welcome you to not only the Startup Health Festival, but coming into our world for a couple of days to see what we're doing all 365 or 366 days of the year. And as Unity explained so eloquently around why we're doing what we're doing and what we've jam-packed into the next 48 hours, we thought it would be helpful to set some context before we do our first fireside chat. And as part of that context, this idea that we began back in 2011 was to really set out and figure out how to do the impossible, the seemingly impossible goals of achieving health moonshots. And of course, the technology we know didn't or doesn't or won't exist for a while. For many cases, the data, the collaboration, the unification, but we really knew that we needed to do something meaningful to try to pioneer a new way of thinking about how to invest in health innovation. And this idea of health moonshot investing really goes back almost 60 years to when JFK proclaimed not only to Congress, but to everyone around the world who watched that famous Rice University speech, that by the end of the decade, we're going to land an American on the moon and bring him safely back to Earth. Now, the technology didn't exist, the funding didn't exist, none of the things that would ultimately allow us to merely 8 or 9 years later land Neil Armstrong on the moon. And what was really fascinating, if you go back and you really understand what happened back then, there was a whole bunch of different things at play. Many people will say some of the instigation was because of people beating us to the moon. Some people talked about the idea that we were doing something that was going to waste a lot of time, money, and energy. And most people started out saying it was impossible. But what is incredibly inspiring is to look at the fact that 400,000 people from 20,000 companies over 8 or 9 years helped allow this picture to be taken of Neil Armstrong. And what's fascinating about that is that everybody hailed Neil Armstrong as the hero, but behind him were 400,000 people. And that is very much the core of why building a global army of entrepreneurs and innovators and investors for us became so clear that this is what we needed to do. But what really struck a chord for us was what happened at home right when JFK was making this broad proclamation of doing this incredibly impossible goal. Neil Armstrong's daughter was diagnosed with a brain tumor, and less than 3 months later passed away. So could you imagine, in 1961 and 1962, this man losing his daughter, yet 8 years later, standing on the moon, thinking, and everyone around the world thinking about this, but not knowing behind that spacesuit was a broken man who, if he could have given up all of that, would have done so in a moment, would have given everything to have his daughter back. And so the theory behind everything we're doing is that no matter how much money you make, no matter how much money you accumulate, no matter who you know, no matter what you could achieve, it doesn't matter when it comes to your mother or your father or your sister or your brother or your child or your friend or yourself. And so this is a picture of Bill Gates and his father, who, for those who haven't seen, his father was diagnosed with Alzheimer's, and his father's progressing through the stages of Alzheimer's, and Bill is making a significant focus on investing in the Alzheimer's Moonshot, the idea of actually curing Alzheimer's. And what most people don't realize is not that long ago, maybe 10, 15 years ago, Bill's mother passed away after being diagnosed with breast cancer. So think about this. Guy's got all the money in the world, but loses his mother to breast cancer in her 60s. Father's gone through stages of Alzheimer's, and it doesn't matter that he is the wealthiest man in the world. So that is at the core of why, instead of looking at the moon and seeing if we could do another moonshot, we wanted to look back at Earth and see if we could take Earth and think about all of the 7.5 billion or 8 billion people on this planet and see if we can focus on achieving 11 health moonshots. And the idea of every one of these 11 moonshots contain dozens of other sub-moonshots. They're big categories like access to care. So everybody in the world, no matter how much money they make, no matter where they live, can access the very best care in the world. Reducing the cost to zero, bringing it down so that whether it's technology, data, or services, we are making healthcare accessible and affordable to everyone on the planet. Curing disease and ending cancer. The idea of prioritizing women's health and children's health. Using nutrition and fitness and brain health as inspirational health moonshots so that we can all rally as entrepreneurs, as investors, as customers and partners, as researchers, as clinicians, really leaning in so that mental health and happiness, longevity and addiction, when we look back in 2040, we will be able to say it was achieved because back in the 20-teens or the 2020s or even the 2030s, we focused on doing it together, not doing it in siloed efforts as organizations or individuals trying to do it alone. And so the Health Moonshot investing model is designed to do a lot more than invest money. So when I said looking back at Earth and seeing what we could achieve, we thought building a flywheel around the definition of Health Moonshot investing so that you could understand investing capital, which is what most entrepreneurs just think they need, is actually just the beginning. So we're investing in entrepreneurs all over the world at scale. We invested in 20 entrepreneurs over the last 90 days. We've invested in over 300 entrepreneurs over the last 8 years, and we're just getting started. The idea of investing capital is just the beginning, though. Investing in uniting the entrepreneurs together in a global army. Investing in broadcasting their stories of progress. Unity talked about the magazine, StartUp Health TV, all of these things, broadcasting stories of progress so that you can read about them, listen to them, watch them, tell their stories of progress. And whether you want to join them in that effort, whether you want to collaborate, whether you want to invest, the idea is to really rally around the hope and the opportunity for us to all do this together. So connecting with a global network of investors and customers and partners is a big piece of the equation for Health Moonshot investing, as is finally the ultimate word of collaboration. The idea of two people or two organizations or dozens or hundreds or thousands of people collaborating, not trying to do it alone, bringing their unique abilities to the table so that each one of us has a role, just like landing Neil Armstrong on the moon was done by 400,000 people. Each one of these health moonshots is going to be achieved by us all working together. So we've built a platform to do just that. You're seeing one of the many pieces of the platform, but investing in entrepreneurs at scale, uniting them together as a global army. We've got 7 different things that we do for all of the entrepreneurs so that they can tap into the power of the peer network. The idea that they're not alone. The idea that they have a personal board of advisors, whether it's on an 8 to 10 person video chat or whether it's coming together in a room like this, they're not alone in doing this. And that's a big piece of it, as is our media network that's designed to tell these stories. So what most people don't realize is that when you open up the magazine and you see those ads and when you actually watch a podcast or come to any of our events, we don't do advertising and sponsorships. Every ad is a house ad for our companies and for our investors and partners to promote them and the great work that they're doing. We don't believe it is important to take advertising dollars to do that. We think it's important to take aligned organizations who for the next 10 years or 20 years are really committed to achieving health moonshots. So 315 investments we just made on Friday, our 315th investment in 25 countries. It's fascinating when you start to meet the entrepreneurs and you see different mindsets and different business models and different things shared around the world by entrepreneurs who one day were alone, and the very next day, they're supported by an entire community who for the last 8 years and for the next 50 years are going to be committed to achieving health moonshots with the same ambition and the same values and the same goals of doing this together. So look at these statistics, and this is one of the things that I'm most proud of. The idea that in the last 8 years, 22 of our companies have been acquired, but that's not the big deal. The big deal is that over 8 years, 315 investments, 252 companies, that's 80% of our investments, are still active. Most of them are here. And while they might not all be rocket ships to the moon, per se, like the unicorns in other industries, they're working tirelessly on something much more important than just a game or an app to let people share pictures of things that ultimately aren't going to matter at the end of the day when that diagnosis comes in or that prognosis comes in. So this is just the beginning. It's the first 8 years. And the next decade and the decade after that, we're going to be able to look back, and without a shadow of a doubt, by 2030, the entrepreneurs that we've already invested in, the entrepreneurs that we're going to keep investing in as we do thousands of investments all around the world, are going to work on the ultimate report card, which is, if you haven't read the UN Sustainable Development Goals, 17 goals that act as a report card for all of us to measure ourselves 10 years from now. In 2030, look at those Sustainable Development Goals. There's one dedicated specifically to health. It's number 3, and it contains the roadmap for all of us to be able to make sure that we're not just looking short term. We're looking at a decade out and saying, what can we do together? And we believe the decade after that gets enabled even more so that we can achieve the health moonshots. So we're just getting started. For those of you who were with us in 2012, our very first year here at JPM, and really when we launched the Startup Health Festival in earnest in 2013, you can see that we made a commitment, not only to each other, not only to our families, as Unity said. We made a commitment that we were going to spend the rest of our lives going all in on making sure that we can not only organize, invest, and support a global army of entrepreneurs working on health moonshots, but we can bring together all of the people and all of the power that comes from linking arms across the aisle, across the country, across the world, to make sure that we're doing this together. So, as part of the kickoff for the festival and our fireside chat, I'm going to ask you to do a little exercise. For those of you in the room who are passionate about or interested in or already excited about one of these moonshots, I'm going to ask you to stand up when I call the moonshot. And I want you to look around the room as I do this. But for those who are interested, excited, already working on, already investing on the Access to Care moonshot and the Cost to Zero moonshot, please stand up. Who's working on the Cure Disease or End Cancer moonshot or wants to be? Everybody still keep standing. No one's sitting down. Cure Disease, End Cancer. Women's health and children's health. Nutrition, fitness, brain health. Mental health and happiness. Longevity and addiction. And now for those of you who haven't chosen or selected or figured out which moonshot's most exciting to you or most passionate, you stand up too. Everybody stand up, all right? Now, I want you to do something. You might think it's a little funny, a little odd. For those who've been here before, you know what's coming next. I want you to link arms to the person to your left and to your right. Now, if you're not linked to your left or to your right, so there's a little aisle, I want you to link arms. Keep going, all the way. All right, and if there is anybody not linked right now, please link up, because we're not moving on until everybody's linked up here. Does that mean YouTube? Yes, it's going to in 2 seconds. Thank you. All right, so now we're going to link in here. Unity, link in here, right over here. We're going to switch arms. Come in here. So I want you to link with Justin right there. All right, we're linked together. So here's the idea. None of these moonshots are achievable alone. So if you work in an organization, if you're an investor, if you're an entrepreneur, and you're like, yeah, I got this, you're absolutely wrong. This is going to happen by linking arms with everyone around the world who's passionate about, excited about, and confident about achieving health moonshots. And I am positive that when we stand here at the Startup Health Festival in 2030, and we're here in 2040, we're going to be able to look back, and all the progress is going to come from those that believe that with the right mindset, the right vision, and a community of people who are as passionate, as committed as we are to achieving health moonshots, it can be done. Thank you so much for being here and spending the next 2 days, spending the next 10, 20, 30, or 40 years doing this with us. Thank you so much. Have a great day. You stay up.